Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is 12 December 2025. This videocast is on a JACC preprint, which is it's a 2025 ACC Concise Clinical Guidance on the diagnosis and management of cardiovascular adverse effects of targeted oncology therapies, BTK inhibitors or Bruton's tyrosine kinase inhibitors, immune checkpoint inhibitors, and vascular endothelial growth factor inhibitors, VEGF inhibitors. It's a report of the American College of Cardiology Solution Set Oversight Committee. What are BTK inhibitors? They're targeted therapies used primarily in B-cell malignancies. Which BTK inhibitor is most cardiotoxic? Ibrutinib has the highest risk of atrial fibrillation and hypertension. The seminal work was done here at Ohio State University. What is the most common cardiac arrhythmia? Atrial fibrillation. Why does atrial fibrillation occur with BTK inhibitors? Off-target kinase inhibition alters cardiac electrophysiology. Who are at the highest risk? Older patients, men, and those with high blood pressure or prior cardiovascular disease. What baseline testing is advised? Blood pressure recordings, EKG, and echocardiography in high-risk patients. Which agents are the preferred for rate control? Beta blockers. Which drugs should be avoided? Diltiazem, verapamil, amiodarone, and dabigatran. Preferred anticoagulant? Factor Xa inhibitors. When should therapy be switched? With recurrent atrial fibrillation, bleeding, or uncontrolled high blood pressure. Now going on to immune checkpoint inhibitors. What is ICI-associated myocarditis? It's immune-mediated myocardial inflammation. How common is it? Rare, but highly lethal. When does it usually present? Within the first 6 to 8 weeks of initiating therapy. Is ejection fraction always reduced? No, the ejection fraction may be normal. What then is the most sensitive biomarker? Cardiac troponins. Which is the best imaging modality for immune checkpoint inhibitors? Cardiac MRI. First-line therapy? High-dose IV steroids. Should immune checkpoint inhibitor therapy be stopped? Yes, immediately in confirmed myocarditis. What is the triple M syndrome associated with immune checkpoint inhibitors? Myocarditis, myositis, and myasthenia gravis. Can immune checkpoint inhibitor therapies be restarted? Rarely, only in mild cases with no alternatives. This is usually decided by a team of oncologists. Clinical takeaway: ICI myocarditis is uncommon, unpredictable, and unforgiving. A normal echo does not reassure, and hesitation to do cardiac MRI costs lives, and hesitation to start early steroids costs lives. Early steroid therapy saves hearts in immune checkpoint inhibitor myocarditis. Finally, the VEGF inhibitors. What's the most common toxicity? High blood pressure. What's the mechanism of hypertension? Endothelial dysfunction and nitric oxide suppression. When does high blood pressure develop? Often within weeks of initiating therapy. Preferred antihypertensives? ACE inhibitors, ARBs, dihydropyridine calcium channel blockers. The role of beta blockers? Useful when concomitant cardiomyopathy exists. What's the risk of thrombosis? Both arterial and venous events. Can myocardial infarction occur? Yes, particularly in high-risk patients. Can heart failure develop? Yes, via afterload stress and myocardial injury. Monitoring frequency? Blood pressure measurements at every visit. When to interrupt therapy? Severe refractory hypertension or acute cardiovascular events. Clinical takeaway: VEGF inhibition tightens the blood vessels while loosening outcomes. Blood pressure vigilance is not optional. It is the price of precision cardio-oncology. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.